foot. Inspect and palpate the following on your partner: the medial and lateral malleolus.
Medial malleolus, shaft of the tibia, distal, medial malleolus, fibula head, down, distally, lateral malleolus.
The medial and lateral tubercles of the talus.
Medial malleolus, talus, calcaneus, posterior, medial and lateral tubercle. In between, the groove for flexor hallucis longus.
The navicular bone.
Medial malleolus, talus, navicular.
Cuboid.
Lateral malleolus, fifth metatarsal, cuboid.
The talus.
Medial and lateral malleolus, talus.
The calcaneus.
Medial malleolus, calcaneus, talus.
The medial, intermediate, and lateral cuneiforms.
Medial malleolus, talus, navicular, medial, intermediate, and lateral cuneiform.
The bases and heads of the metatarsals.
Metatarsals, first, second, third, fourth, fifth. Base and heads.
The proximal and distal phalanges of the hallux.
Proximal and distal.
The proximal, middle, and distal phalanges of digits 2 through 5.
Proximal, middle, and distal.
The tendons of the ankle and foot. Inspect and palpate the following on your partner: the calcaneal tendon.
Calcaneal tendon. From the gastric and soleus, musculotendinal junction, down to posterior calcaneus.
The fibularis longus tendon.
Fibularis longus, proximal attachment, distal attachment, going behind the lateral malleolus, down, going to the first metatarsal, base of first metatarsal, and the cuneiform.
Fibularis brevis tendon.
Fibularis brevis, proximal attachment, going around lateral malleolus, distal attachment, fifth metatarsal tuberosity.
Tibialis anterior tendon.
Tibialis anterior, going down, distal attachment, base of the first metatarsal and first cuneiform.
Extensor hallucis longus tendon.
Extensor hallucis longus tendon, distal attachment, distal phalanx of the first digit.
Extensor digitorum longus tendon.
Extensor digitorum longus tendon, distal attachment, distal phalanges.
Adductor hallucis. Origin of the oblique head, the bases of the metatarsals 2 through 4, the transverse head, the plantar ligaments of the metatarsal phalangeal joints. The distal attachment is to the tendons of both heads, attached to the lateral side of the base of the proximal phalanx of the first digit. Abductor digiti minimi. Proximal attachment is the medial and lateral tubercles of the tuberosity of the calcaneus and the plantar aponeurosis and intermuscular septa. Distal attachment is to the lateral side of the base of the proximal phalanx of the fifth digit. Active range of motion of the foot and ankle joint. Active dorsiflexion of the foot. Plantar flexion of the foot. Active inversion of the calcaneus at the subtalar joint. Eversion of the calcaneus. Active flexion of the metatarsal phalangeal joints. Extension. Abduction. Adduction. And circumduction. Active proximal and distal interphalangeal joint flexion. And extension. Passive motion of the ankle joint, dorsiflexion. Plantar flexion. Passive inversion of the calcaneus. Passive eversion of the calcaneus. Passive metatarsal phalangeal joint flexion. Extension. Abduction. Adduction. Circumduction. Proximal and distal interphalangeal joint flexion. Extension.